In the 1920s through to the 60s, colonial governments left a mark in Africa, from schools, government houses, offices to roads. A key hallmark of colonial rule in the construction industry is asbestos roofs, made of what was once referred to as a miracle mineral but has since turned into one of the most dangerous industrial hazards to date. A cheap, durable and fire-resistant roofing component, asbestos has withstood the test of time and remains firm on old government structures like hospitals, schools, police barracks and hotels in Uganda. Even when the United Nations and World Health Organization banned asbestos use in all its forms globally, government has not done much to stop the exposure of Ugandans to asbestos.
Ne tuyingira omwezi omulala ne tuyingira omwaka ne gugwako ne bagamba bagenda menyawo naye nga kale ffe balandodi baffe basigala batugumya.
I know it's roofed with asbestos, but I have no choice because for the 33 years I was teaching, I was renting.
Asbestos ne raza cancer.
I think it was a cancer.
In Zambia, a Kampala suburb hosts perhaps the oldest police barracks in Uganda. Over 1,000 police officers live here. The compound has old and new structures. But taking a closer look at the police quarters, one notices old and worn-out asbestos roofs sheltering the men and women in uniform. Most of these roofs have weakened with age and the evidence is in broken particles. This means the occupants are living dangerously since the roofs could give way any time. We visited Kampala, Fort Portal, Soroti, Kumi, Jinja, Kabale and Gulu. And in all these districts, asbestos roofs are evident, especially on government facilities and some private structures. At Fort Portal Police Barracks, we filmed from a distance the filthy conditions in which the police officers live. The asbestos roof on this building is hanging precariously. A cancer specialist and director of the Uganda Cancer Institute, Dr. Jackson Orem, says asbestos presents a more serious health risk when it's old and begins to break.
Because of weather, because of maybe any impact or force begins to disintegrate, then it begins to release those fibers into the atmosphere.
You can inhale them, and they can, when you inhale them, they, from the public health perspective, it can go and get lodged into your lungs. Because they are very, very small microstalline structures.
Fortunately, we are also building, over a period of time, we are building new structures in the different stations. And of course that means we don't include the asbestos aspect.
The Fort Portal situation also plays out in Bali. The asbestos roofs of the police staff quarters are falling apart. A police officer who spoke to us on condition of anonymity said many of their families have been forced to drink unboiled water harvested from asbestos roofs since quite often water to the barracks is cut off due to unpaid bills. Such water may affect the respiratory system.
You die, then you don't know why you have died. If you don't know someone has died, then you create a story around the death, but the issue is asbestos.
The situation is the same in other police barracks across the country.
In Gulu, in Jinja, in Soroti, in Iganga, in Mbale and Atiak. We are replacing them and we do it in phases because of budgetary issues.
But it's not just the police. At Makerere College School in Kampala, which is one of the country's oldest schools, students and staff still study and reside under asbestos-roofed structures.
%98 of the classroom is asbestos. And then labs, laboratories. And then of course teachers' houses. Almost all of them.
At the recent Diamond Jubilee or 60th anniversary celebrations of Kigezi College Butobere, the issue of asbestos in the school came up again.
All asbestos sheets were condemned to be cancerous. So for a government school to still be covered by asbestos sheets would mean that actually we are posing danger to the very students that we are educating.
According to the National Environmental Management Authority Executive Director, Tom Okurut, asbestos is dangerous when tampered with.
And that's why it comes in. Because avoidance of breaking. When you break, it becomes, you get exposed to the dust, asbestos dust. And of course, sometimes if the truck, if you step on the asbestos, if you step on the truck, I've seen those when they were removing the ones in Naguru, some trucks went over this thing and it was just powder asbestos all over. We had to just do a remedial action. We put water, soap, to first collect it and then we removed it. Because that dust, if it's blown by wind, it just becomes just a very dangerous thing. You'll breathe it without knowing.
And yet, at Buganda Road Primary School, part of the 79 schools managed by Kampala Capital City Authority on behalf of government, we found that asbestos roofs had been repaired and replaced with iron sheets.
When it cracks, even in the house, when it cracks, it becomes like dust. Then the risk comes in. And that is what's common. That's common, and most of the old asbestos houses have been affected. They've either broken down or whatever. You'll see holes and whatever, so the risk comes from there.
According to experts, the cancer risk from asbestos varies from the length of time and amount of crystallite inhaled, while those in manufacturing are at a higher risk than those living under these roofs. Some habits could raise the cancer risk. Last year, Kyambogo University staff threatened to sue government for exposing them to cancer from asbestos in their staff quarters. Because of lack of informed research and sensitization of masses about the issue, Ministry of Health says they are not aware of any cancer cases as a result of asbestos.
Realize that the effect will be, let's say, 20 years after. So the people now getting the cancer, I mean the people are still at risk because they were exposed earlier. So the challenge is our people are already exposed. It will now, even if we do it now, we are saving the future generation. But the good thing, it's not really, we don't have many cases, let me put it like that, associated with cancer of the lungs due to asbestos.
So why is it that not much has been done 32 years later, yet the International Labour Organization Convention of 162 of 1986 condemned asbestos and ordered its replacement?
For Buganda Road, what I'm clearly stating is that we have not received any grant for development in the school, but we have always annually received the capitation grant as the UPE grants. That is for the day-to-day running of the school, maintaining the child in school. That's what we have received. The whole year on average is 25 million shillings because we are given, according to the enrollment, 10,000 shillings per child per year.
The reason for the delay of implementation is largely attributed to the high cost involved in the demolition replacement of roofs.
If the budgets could allow, we would have done this even yesterday. But because we have different priorities and we don't have all the resources that we need to do a complete overhaul at a go, we would need about 1.9 billion, close to 2 billion, to replace all the roofs in the schools.
According to a 2016 petition to Parliament, Kyambogo University needs 200 million shillings to remove asbestos from each building.
Most of the schools we spoke to do not seem to have asbestos re-roofing or de-roofing as one of their priorities, largely because the effects of asbestos are not immediate. They're only seen after 10 to 20 years.
It means if you are exposed today, for instance, it will take up to about 20 years before you begin to manifest with the disease. Of course, the most well-known is the development of lung cancer eventually, but there is a condition we call asbestosis, which usually is a condition where there is damage to the lung, mainly because of inflammation, and it causes the lung to fail to function, and the manifestation is with shortness of breath. Eventually, of course, it can lead to death, but it is not cancerous. And then the third manifestation is what we call mesothelioma. Mesothelioma is when the asbestos fibers get to the lining, usually of the lung and then other organs in the body, and then causes a situation where there is collection of fluid, and eventually, actually, most patients die because of either failure of the organs.
It is a project which needed the country to be annoyed. They should be annoyed, like Parliament should be annoyed and say, no more asbestos roof. Wherever it is, if you are the one living in the house, remove it. If it is a public institution, let the government come in and remove everything. To me, I would like that to be that kind of way. If, for example, the Ministry of Education, because it is our parent ministry and it is where the budget goes through and comes back from, if it could say, we are cutting your expenditure, we are removing asbestos roof, to me, I would be very grateful.
The dangers of asbestos first came up on the floor of Parliament on August 22, 2002. As Uganda's current ambassador to Malaysia, then chairperson of the Sessional Committee on Social Services, Dorothy Huha, while presenting the committee's report, noted that, and I quote, "Many institutional buildings in remand homes for children are still roofed with asbestos, and note that asbestos has been proved internationally to cause cancer." According to the Hansard, this was never debated on by any member of parliament in their reactions to her report. The debate then came up again on 18th August 2004, and then on 14th June 2016, and many more times. In total, 21 times in 16 years. And yet, when one scans through Parliament Hansard, it appears that the debate always comes up on the floor of Parliament, and that's all. Perhaps one of the most detailed discussions in Parliament about asbestos was in 2006. Then, Oyam County South Member of Parliament Dr. Okulo Epak, while expressing his frustration about government negligence about handling asbestos, asked government to list all schools that were still roofed with asbestos. In his response, Minister of State for Higher Education Gabriel Opio listed at least 31 schools, which he said were only indicative of the extent of the problem. Some of these schools included Iganga High School, Chebambe Girls School, Palisa Secondary School, Koma Secondary School, Loro Secondary School in Oyam, Kotido Senior Secondary School, City High School in Kampala, Wanyange Girls School, Kako Senior Secondary School, St. Elizabeth Senior Secondary School, Bududa, among others. Gabriel Opio then noted that, however, due to financial constraints, it has not been possible to replace the asbestos sheets with iron sheets on buildings of all the educational institutions in the country. The Minister of Education and Sports will, however, replace the roofs in a phased manner beginning from the next 2 financial years. However, in the subsequent budgetary allocations, no monies were allocated to these schools for this particular project. During the same debate on the floor of Parliament, then Kumi MP and now FDC President Patrick Amuriat then tasked government to carry out a research on asbestos in the country with a view to establishing the number of people who might have contracted asbestos-related illnesses. Then Prime Minister and Leader of Government Business Apollo Sibambi instructed the Ministers of Education, Housing and Health to institute a committee that would carry out a research and even generate a national policy on dealing with asbestos. Apollo Sibambi said, and I quote, "It's difficult to have a time frame. It has a financial implication as well. It's difficult for me to have a time frame now, but it's a very urgent matter. I believe that 3 months are reasonable. However, 12 years later, no such policy has been generated, as the Acting Director General of Ministry of Health, Dr. Mwebesa, confirms."
But in our country, we have not yet done studies to confirm the exact impact of asbestos, much as we know that there are many institutions, schools, hospitals, and even some government quarters which have been roofed with asbestos. I think as a government now we need to be more proactive.
The last and final time a discussion about asbestos in public buildings was raised on the floor of Parliament was on 10th May 2017, when Dr. Hakanargunda further re-echoed government's commitment. In May 2017, Leader of Government Business in Parliament, Prime Minister Dr. Hakanargunda said an interministerial committee chairs was working to ensure that asbestos roofs in government facilities were replaced. We couldn't readily establish how much progress the committee has made. However, the National Environmental Management Authority, or NEMA, a body mandated to regulate and enforce public and environmental health, says many institutions were issued with notices 2 years ago, which expired in December. Even then, NEMA has not taken any action to enforce compliance, which is its job.
Our next step is now to come and enforce. Okay, we'll come and enforce. We are going to give a notice, not again 2-year notice to the institutions that are there, a closure notice to the institutions who have not removed asbestos.
According to experts, when asbestos fibers are breathed in, they may get trapped in the lungs and remain there for a long time. Since it is dangerous to get into direct contact with asbestos roofs, NEMA has enlisted companies to deroof buildings.
The very reason why we don't want you to remove asbestos and throw them out is because when you throw them out, they get crushed and the exposure to the public becomes much more. So that's why we say you get a farm, you get a company that now takes those asbestos for disposal in specified areas, landfills, where they are buried completely. But even you as an individual, you can follow that criteria to remove your asbestos. You don't necessarily need. But for big institutions of government, the only best way is to hire a firm to remove it for you. Because then they will come with the protective wear, they will come with all those things to contain the dust that will arise from the what? From the removal process. Because you need to wear glasses. Sometimes we have seen cases, there have been reported cases, as you are puff up, the asbestos gets into you. The needle just pierces your eyes and you're done.
Asbestos is banned in more than 55 countries around the world, including Japan, Australia, and all countries in the European Union. While the International Labour Organization banned this mineral, Russia is still the world's leading producer of asbestos, while China is the world's leading consumer of asbestos, closely followed by India. In the 70s, South Africa was the world's #3 producer and exporter. However, the mines have since been closed.
Given that we know that asbestos is risky, we should join the rest of the world in no longer continuing to use them for materials for use like in roofings.
Uganda's failure to get rid of these roofs could mean more people could present with cancer in future because of early warnings but late responses. Sharon Hochre, NTV Panorama.